เรียนท่านนายแพทย์ทิติแสวงธรรมนะคะรองอธิบดีกรมอนามัยค่ะผู้บริหารกระทรวงสาธารณสุขทุกท่านนะคะแล้วก็ผู้อำนวยการโรงพยาบาลทุกท่านค่ะแขกผู้มีเกียรติทุกท่านด้วยนะคะวันนี้ธีรณีจากองค์การอนามัยโลกประจำประเทศไทยค่ะก็ขอบพระคุณนะคะกรมอนามัยที่ให้เกียรติเราได้ร่วมมาแลกเปลี่ยนและแชร์ความรู้ประสบการณ์ในวันนี้นะคะจริงๆธีรณีไม่ได้พูดเองค่ะวันนี้อยากให้ทุกท่านได้ยินได้รับฟังจากมุมมองของนานาชาติซะมากกว่าก็ได้มีการไปเชิญนะคะเจ้าหน้าที่ต่างชาตินะคะจากองค์การอนามัยโลกภูมิภาคเอเชียตะวันออกเฉียงใต้นะคะหรือว่า WHO Zero นะคะมาร่วมแชร์ข้อมูลค่ะซึ่งเป็นคุณฟอสตินาโกเมสค่ะแกเป็นเจ้าหน้าที่วิชาการนะคะ Wash Sanitation and Climate Change ค่ะวันนี้เขาก็จะมาเล่าให้เราฟังนะคะถึงการเปลี่ยนแปลงทางสภาพภูมิอากาศผลกระทบทางสุขภาพนะคะแล้วก็ผลกระทบต่อระบบสุขภาพรวมไปถึงแนวทางการดำเนินงานนะคะการที่จะรับมือหรือแก้ไขปัญหาที่องค์การอนามัยโลกได้ให้คำแนะนำไว้ค่ะขออนุญาตเป็นให้ทุกท่านได้เชิญชมคลิปค่ะขอบพระคุณค่ะ
Good morning and good afternoon, everyone. I'm Faustina Gomez, and I'm the Technical Officer for Climate and Health at WHO Southeast Asia Regional Office. Thank you for having me here today. And today we're going to talk about climate resilient and environmentally sustainable healthcare facilities, specifically on strengthening climate change mitigation and adaptation in healthcare facilities and challenges to sustainability. As you may already know, climate change is affecting health, and it's affecting health in many different ways. The impact is being felt not only by people, but also health systems and facilities. Health facilities are, of course, critical, and we often say that they are the first line of defense against climate change. Healthcare facilities are exposed to climate hazards, which can result in reduced quality of care. At the same time, the healthcare sector itself impacts the environment, contributing to greenhouse gas emissions through energy use, transportation, and the production and utilization and disposal of medical products. So, what are climate resilient healthcare facilities, and what does it mean to apply a climate resilience approach to health systems? In simple terms, a climate resilient health facility is one that can withstand and adapt to environmental shocks such as floods or storms, while maintaining essential healthcare services. The concept can be visualized through a graph that you see here. A healthcare facility operating under normal conditions follows a stable trajectory, as shown as a flat line in the graph. However, when a crisis occurs, such as a sudden increase in patients due to a disaster, its capacity is tested. Initially, the facility may struggle as it responds to a surge in demand. However, if it is well prepared and resilient, it can recover, stabilize, and continue providing essential care. Over time, the facility can even improve by learning from the crisis, strengthening its systems, and enhancing healthcare quality. However, if it is not prepared, it may never be able to recover, or it may even collapse. Building resilience requires proactive preparedness, adaptive capacity, and an understanding of local risks. Many healthcare facilities have collapsed under pressure, as seen during the COVID-19 pandemic. To prevent similar failures in the future, action must be taken now to strengthen health systems, ensuring that they can withstand and recover from climate-related and other crises. In other words, we want healthcare facilities that can anticipate and prepare for future challenges, effectively respond to crises, adapt to changing conditions, recover from disruptions, and ultimately emerge stronger. And this is the core concept of resilience or adaptation. In addition to resilience, healthcare facilities must also consider their environmental impact. A facility dedicated to protecting community health should not simultaneously contribute to environmental harm through excessive emissions. It is therefore essential to align healthcare objectives with sustainability, ensuring that efforts to provide quality care do not contradict environmental responsibility. Reducing healthcare-related emissions is a critical focus area, and this involves identifying key sources of emissions within the facility, whether from energy consumption or fuel use, supply chains, transportation, or other operational processes. By pinpointing these hotspots, facilities can implement strategies to lower their carbon footprint while maintaining or even improving healthcare quality. The carbon footprint of health systems and facilities is measured across three scopes. Scope 1, direct emissions from healthcare facilities, including, say, fuel combustion or on-site energy use and hospital-owned transportation. Scope 2, indirect emissions from purchase, electricity, heating, and cooling used by healthcare facilities. And Scope 3, which is indirect emissions from the broader healthcare supply chain, including medical equipment production, pharmaceuticals, waste disposal, and staff or patient transportation. So these emissions can be estimated using two approaches. Top-down, which calculates total GHG emissions for the entire health sector, and bottom-up, which assesses emissions by analyzing specific activities within the system. And then there is also a hybrid approach, which combines these two approaches. The ultimate goal is to achieve a balance where a facility delivers high-quality healthcare services while minimizing its environment impact. This is depicted by the green box in the top left corner. Some facilities may need to prioritize emission reductions, while others may need to strengthen resilience and adaptability. Regardless of the starting point, the overarching aim is a healthcare system that is both sustainable and capable of providing effective care under any climatic condition. So the goal is a climate resilient, low carbon health system for countries at different developmental levels, and all health systems should eventually achieve net zero emissions, with many targeting this before 2050. So drawing on all our years of experience in climate change and health and piloting this work in many countries, in 2020, WHO published the guidance for climate resilient and environmentally sustainable healthcare facilities. The goals of this guidance were to increase the climate resilience of health facilities, to protect and improve the health of their communities in an unstable and changing environment, optimize the use of resources, and minimize the release of waste by becoming environmentally sustainable. The WHO operational framework for climate resilient and low carbon health systems and the WHO guidance on climate resilient and environmentally sustainable healthcare facilities are closely related and complement each other in strengthening health systems against climate change while reducing environmental impact. While the operation framework provides a broad system-wide approach for national and subnational health systems to become more resilient to climate change while reducing greenhouse gas emissions and are organized around the health system's building blocks, the WHO guidance on climate resilient and environmentally sustainable healthcare facilities offers a facility level approach, providing practical steps for individual healthcare facilities to prepare for climate hazards and reduce their carbon footprint. Together, they create a comprehensive roadmap for ensuring healthcare systems can withstand climate impacts while minimizing their environmental footprint. Now, coming back to the guidance, actions within this guidance are organized around four fundamental requirements for providing safe and quality care. This includes health workforce, water sanitation, hygiene, and healthcare waste management, energy, and infrastructure technology and products. Interventions under each will increase the resilience, the adaptive capacity, and the environmental sustainability of healthcare facilities. So this diagram basically shows how these four fundamental requirements support in increasing climate resilience and environmental sustainability, and the figure also shows three objectives under each of the four fundamental requirements for safe and quality care. The guidance proposes examples of interventions across four areas and the three objectives under each area for both climate resilience and environmental sustainability. And selection of interventions are to be based on the local context. Many interventions are cross-sectoral and will need collaboration outside of the health sector. So this here is an example of the climate resilience related interventions covered as part of the human resources objective under one of the fundamental requirements, that is health workforce. Just as a reminder, the results of the assessment will have to inform the selection of interventions for the improvement plan. And here is an example of climate resilience related interventions covered as part of the health and safety regulation objective under the fundamental requirement of energy. As mentioned before, interventions can be selected and adapted to the local context. Now, the level of achievement is color-coded in orange, yellow, and green. Orange indicating low, unavailable, or unable. Yellow indicating medium, in progress, or incomplete. And green indicating high, completed, and achieved. This allows interventions marked orange and yellow to be converted into activities that are to be included as part of the improvement plan. It's important to remember here that the guidance and interventions are basically designed to be flexible and adaptable, allowing for creativity and basically customization on specific contexts. There are no rigid rules, but rather a framework that can be modified, expanded, or even removed if they do not fit the local needs. The key idea behind these checklists and interventions is that they serve as guidelines, not strict instructions, and they are meant to support healthcare facilities while also allowing them to refine and adapt the approach based on what works best. For instance, different contexts may require different adjustments, and that flexibility is basically built into the process. The guidance provides a structured approach with 5 key steps for conducting this assessment. So let's go through them one by one. First, we assemble and train a multi-sectoral team, a group of experts who will lead the assessment process. Next, we establish the baseline. This is done in 2 ways. For adaptation-related interventions, we use a checklist to assess the vulnerabilities of healthcare facilities in the context of climate change to evaluate the risks and plan adaptation strategies. I'll be shortly taking you through this tool. For mitigation-related interventions, we assess greenhouse gas emissions in the health sector using 2 key tools, the Aga Khan Development Network Carbon Management Tool and the Healthcare Without Harm Climate Impact Checkup Tool. Once we have the baseline, we define and prioritize interventions. Using checklists under the 4 fundamental requirements, we identify both short and long-term action. I just showed you this a little while ago. With priorities now in place, we then develop and implement an improvement plan, ensuring that necessary measures are put into action. And finally, we monitor and evaluate progress. This helps us assess the impact of our interventions, make necessary adjustments, and continuously improve health facility resilience and sustainability. And by following these steps, we can systematically strengthen climate resilience and sustainability in healthcare facilities. Before implementing any intervention, it is crucial to assess the current situation, conduct a baseline assessment, identifying risks, vulnerabilities, and specific needs of the healthcare facility. In 2021, WHO developed a checklist to assess the vulnerabilities of healthcare facilities to climate hazards. So this is a complementary tool to the WHO guidance for climate resilient and environmentally sustainable healthcare facilities. And the main goal of this checklist is to help health facility managers and other health workers establish a baseline for climate resilience in their facilities. So the checklist is structured around different climate hazards, including floods, storms, sea level rise, droughts, heat waves, wildfires, cold waves. And for each hazard, the checklist focuses on 3 key areas: identifying climate hazards of concern, assessing current vulnerability for each of the hazards in each of the key components of healthcare facilities, and understanding potential impacts posed by climate variability and change in each of the key components of healthcare facilities. So the baseline assessment begins by filling the hazard template. So this template helps to identify the climate hazards affecting the health facility, if hazards or exposures present, and the key areas affected by the hazard. This is followed by a template to help identify vulnerabilities and impacts on healthcare facilities for each of the 7 hazards across the 4 areas. So tables to assess vulnerabilities and impacts are divided based on objectives for the implementation of each component and follow the process and rating levels proposed in the WHO guidance for climate resilient and environmentally sustainable healthcare facilities. So this is an example of a checklist to identify vulnerabilities in the case of a flood. Similarly, there are tables for other hazards across all 4 areas. And these tables are in the form of questions to identify if a health facility is implementing measures to respond to climate hazard by reducing vulnerabilities in order to lessen or avoid potential damage and disruptions to service delivery. The level of vulnerability for each item in the list can be assessed as high, medium, or low. So this checklist basically answers questions on where are you in terms of if a flood comes, or how it will be affecting the healthcare facility and what vulnerable areas are there at the present time. And finally, there are tables for assessing impacts of climate change to healthcare facilities that follow a risk matrix model focusing on the severity of impact. This could be major, moderate, or minor, but assuming equal likelihood of occurrence. So these tables show examples of impacts that healthcare facility can suffer and which the user can identify and evaluate based on the level of impact. Once impacts are identified, the user can then list the potential interventions to respond to the identified areas of concern. And relevant guidance to develop interventions is included in the guidance for climate resilient and environmentally sustainable healthcare facilities. So overall, the approach is highly customizable. Facilities can focus on the hazards most relevant to them, add new ones, or refine the checklist as needed. For example, in regions where, say, there are dust storms, or where dust storms are a concern, additional assessment questions can be developed. And by using this tool, healthcare facilities can actually prioritize their actions addressing the most critical vulnerabilities first. The ultimate goal is to implement interventions strategically and ensure that resilience building efforts are both effective and sustainable. So here's an example of a fill table with the potential impacts of a heat wave, flood, storm, or sea level rise on the health workforce, wash, energy systems, and infrastructure and technology in the healthcare facility. So a number of countries have actually used this tool in the region and beyond. This is a case study of Iran, where the Ministry of Health commissioned a project to evaluate the climate resilience and environmental sustainability of healthcare facilities in 6 regions of Iran. In this project, 267 healthcare facilities were selected, including 48 hospitals, 65 health houses, and 69 rural and 50 urban and 35 rural and urban health centers. To collect the data, they utilized the WHO tool, and they adapted the tool to the local context, and data was collected across all 4 areas, that is health workforce, wash, energy, and infrastructure technology and products at 3 levels, low, medium, and high performance. And finally, data analysis was performed. The results are shown here, and these results were used to formulate 10 key strategies and 43 practical interventions for improving the level of climate resilience and environmental sustainability in these healthcare facilities. Similar assessments have been conducted by both countries within and outside the region. We also have a number of best practices within the region where countries such as Maldives and Timor-Leste have undertaken a number of initiatives. Now, Thailand is also leading the way with its Green and Clean Hospital initiative, implemented by the Ministry of Public Health, which aims to foster sustainable sanitation and environmental friendliness in over 200 plus healthcare facilities, which is an achievement considering the sheer scale of the initiative. So, countries such as Nepal and Bangladesh have also conducted baseline assessments of GHG emissions of the health sector using the Healthcare Without Harm and Aga Khan Development Network tool, respectively. The assessment has identified major emission hotspots, and a plan of action is currently being developed to reduce the emissions in the health sector. So this is again an example of how countries have worked on assessing the GHG emissions of the health sector, and more countries are doing it of late, especially countries that have committed to the COP26 health program. Now, coming to the challenges to sustainability of the initiative. So there are many challenges, and these include financial constraints and investment needs, beginning from limited funding. So many healthcare facilities, especially in low resource settings, they struggle with inadequate budgets for implementing sustainable practices. There are high upfront costs. So transitioning to climate resilient and low carbon infrastructure, it requires significant investment in energy efficient systems or renewable energy sources and waste management solutions. There are also return on investment concerns. So decision makers may hesitate to allocate funds for sustainability initiatives due to, say, uncertainty about long-term financial benefits. Then there is the lack of financial incentives. There's limited government subsidies or incentives for green healthcare infrastructure, which can make it challenging to basically justify sustainability investments. Moving to the next one, which is technology and infrastructure limitations. Beginning with outdated facilities. So many healthcare facility infrastructures are not designed with climate resilience or sustainability in mind, making retrofitting expensive and complex. Energy efficiencies. So high energy consumption from medical equipment, lighting, heating, and cooling systems, it increases the operational costs and carbon footprints. Limited access to green technologies. We all know this. Some healthcare facilities, particularly in remote or low-income regions, they lack access to sustainable technology solutions such as, say, solar power, energy efficient medical devices, or water-saving systems. Supply chain vulnerabilities. Sustainable procurement of medical supplies and equipment is often hindered by limited availability, high costs, and complex logistics. Moving on to the next big gap, which is policy and regulatory gaps. So inconsistent or weak policies. In many regions, there is a lack of comprehensive policies that mandate sustainability and climate resilience in healthcare. Regulatory barriers. Some existing healthcare regulations may not align with or may even hinder the adoption of greener practices, such as strict requirements on medical waste disposal that prevent sustainable alternatives. The lack of enforcement. Even where policies exist, enforcement mechanisms may be weak, leading to inconsistent implementation of sustainability measures. Fragmented governance. So coordination among health, energy, environment, and finance sectors are often weak or lacking, making it difficult to implement cross-sectoral sustainability initiatives. And finally, the need for capacity building and stakeholder engagement. There are knowledge and skill gaps. Healthcare workers and facility managers, they may lack training on sustainable practices, energy efficiency, and climate adaptation strategies. There's limited stakeholder awareness. So policymakers, healthcare professionals, and the general public may not fully understand the importance of integrating sustainability into healthcare operations. Then there is obviously the resistance to change. So institutional inertia and reluctance to shift from traditional practices to innovative, sustainable approaches can basically slow progress. And this we have seen in many countries. Then multi-stakeholder collaboration challenges. So achieving sustainability in healthcare requires coordinated efforts, as I said before, especially among government agencies, private sector players, non-profits, and local communities, which can be difficult to manage effectively. So addressing these challenges, it requires strong policy frameworks, increased financial investment, adoption of innovative technologies, and capacity building efforts to integrate sustainability into healthcare systems effectively. So I've come to the end of my presentation. For any questions, please feel free to email me on the ID that is provided on this site, on this slide, sorry. And thank you so much again for this opportunity to present, and Kapunka.
ค่ะขออนุญาตสรุปเป็นภาษาไทยสักครู่นะคะไม่เกิน5นาทีค่ะเนื่องจากระยะเวลาที่จำกัดค่ะก็คุณฟอสติน่านะคะ presentation ของเขาแบ่งเป็นประมาณ3ส่วนด้วยกันค่ะส่วนแรกก็คือปัญหานะคะที่เกิดขึ้นมาแน่นอนนะคะจากการเปลี่ยนแปลงทางสภาพภูมิอากาศค่ะไม่ว่าจะเป็นภัยต่างๆทางธรรมชาติทางสิ่งแวดล้อมนะคะแล้วก็ภาระทางสุขภาพที่จะเพิ่มขึ้นด้วยค่ะซึ่งส่วนที่2เขาก็ได้พูดถึงแนวทางที่องค์การอนามัยได้ให้คำแนะนำไว้นะคะก็คือเป็น3 component หลักก็คือ1ระบบสถานบริการเนี่ยต้องปรับตัวเพื่อรับมือกับภัยเหล่านี้ให้ได้นะคะส่วนที่2นอกจากภัยทางธรรมชาติเนี่ยก็ต้องรับมือกับภาวะหรือโรคต่างๆที่เพิ่มขึ้นนะคะจากการดูแลสุขภาพของประชากรให้ได้ค่ะส่วนที่3เนี่ยระบบสาธารณสุขของเราเองจะต้องไม่เป็นผู้ร้ายค่ะเราจะต้องไม่ปล่อยคาร์บอนเพิ่มขึ้นทำลายโลกมากกว่านี้นะคะในส่วนของแนวทางที่องค์การอนามัยโลกได้ให้ไว้เนี่ยจริงๆแล้วเขาไม่ให้ขึ้นสไลด์เนื่องจากเวลาไม่มีแต่อยากเน้นนะคะเดี๋ยวเขาจะอัปโหลด materials ก็คือจะมีวงล้อ operational framework ที่องค์การอนามัยโลกได้ให้คำแนะนำไว้นะคะก็คือ เป็น six building blocks ของ health system ค่ะมีการ integrate climate change component เข้าไปนะคะในปี 2023 ค่ะตัว operational framework นี้เคย publish ไว้นานมากแล้วในปี 2014 นะคะแต่ว่ามีการ revise มีการทำให้อัปเดตมากยิ่งขึ้นนะคะในส่วนของอาจจะไม่มีเวลาอ่าน6 building block นะคะก็จะมีส่วนของ service delivery healthcare workforce นะคะการใช้ health information system ในการประเมินหรือว่าการรับมือกับภาวะแล้วก็โรคภัยต่างๆที่เกิดขึ้นนะคะมีในส่วนของ financing leadership and governance นะคะก็รบกวนทุกท่านหากมีเวลาเพิ่มเติมสามารถไปดูข้อมูลเพิ่มเติมได้ค่ะส่วนสุดท้ายนะคะคุณฟอสซิน่าได้ให้ข้อมูลนะคะหลังจากหลายๆประเทศเนี่ยได้นำ operational framework ของ WHO ไปใช้นะคะก็มีความท้าทายมากมายนะคะโดยเฉพาะในเรื่องของงบประมาณค่ะหลากหลายประเทศที่เป็น low income countries เนี่ยจะมีปัญหาทั้งเรื่องงบประมาณอย่างใหญ่หลวงนะคะแล้วก็ไม่ว่าจะเป็นตัว infrastructure ของเขาเองที่เก่าแล้วก็ไม่ได้อัปเดตนะคะในส่วนของการที่ไม่สามารถเข้าถึงGreen Facility หรือ Green Equipment ได้นะคะห่วงโซ่อุปทานของเราอย่างที่เราทราบกันดีนะคะปล่อยคาร์บอนอิมิชันมากกว่า 70% ของระบบสาธารณสุขทั้งหมดค่ะแล้วก็มีการบริหารการจัดการที่กระจายนะคะอย่างเช่นเราได้เห็นตัวอย่างก็คือหลายๆหน่วยงานหรือว่าภาคีหลายๆเซกเตอร์เนี่ยไม่มีข้อมูลที่เชื่อมต่อกันไม่มีการร่วมมือกันแล้วก็การบูรณาการอย่างเป็น holistic approach ค่ะสุดท้ายนะคะเขาได้เน้นย้ำถึงความจำเป็นในการสร้างศักยภาพและการมีส่วนร่วมของผู้มีส่วนได้ส่วนเสียนะคะไม่ว่าจะเป็น healthcare sector ของเราเองเนี่ยยังมีการพูดถึงการเข้าไปให้ความรู้ที่ชุมชนแล้วก็ประชากรที่เข้ามารับservice ด้วยค่ะก็ขออนุญาตสรุปประมาณเท่านี้ค่ะขอบพระคุณค่ะ
ค่ะขอเสียง